This was a 40-year-old male who was referred probably in November of 2008, and following a routine referral by his general practitioner with symptoms of tiredness and lethargy, he was referred as a routine patient with sleep apnea syndrome. And on the face of it, he fulfilled all the criteria for that. He was male, he was of the right build. He gave a history of heavy snoring and tiredness and lethargy. And when we checked him against a sleep questionnaire, he had a very, very high score. He scored 20 out of 24. So on the face of it, this is a barn door case of sleep apnea syndrome. But there's just something slightly different about his history. And this is the fact that he had quite severe headaches. Now, we can anticipate headaches in approximately 30% of patients with sleep apnea syndrome, but these headaches seem to be a little bit unusual. They were much more severe than I would have anticipated. And then going through the history, obviously one was slightly concerned that there's something else going on here, and slightly something more amiss than just simply sleep apnea syndrome. And when one went through things carefully, obviously there are lots of causes for headaches. You can have brain tumours, migraine, various endocrine problems, hormonal type problems, but something didn't ring true with that. And normally in the chest clinic, this is part of the chest clinic, we see patients with quite severe lung disease, and these patients at the extremes of the lung disease, they have problems exchanging air, and that means they cannot take oxygen into the body, and they cannot expel carbon dioxide. And these patients at the very end of their lives have problems with carbon dioxide build-up. And I suppose it was a little bit of inspired clinical judgment and lateral thinking. Then I thought perhaps there's something else going on here, and I thought of carbon monoxide poisoning. And this is a very, very difficult condition to diagnose because the symptoms are often very non-specific. Term flu-like symptoms, so you can get nausea, headaches, dizziness, a little bit of confusion. And when I started inquiring about other family members, whether they had any similar symptoms, it was obviously the case that there was a problem obviously with the whole family, but obviously Peter seemed to be the worst affected. And obviously what I in fact asked him to do immediately is to go home, turn off the gas boiler and call in the emergency gas services. And when the gas people came round, the Transco, and the gas engineer, they actually identified a serious problem with Peter's boiler. I think the inlet had been blocked, I think actually by cat hair and cat fur. But quite clearly they spent 4 hours trying to service the boiler, and I think in no uncertain terms the gas engineer said that, and if he'd left the boiler on overnight, then the family would have effectively been wiped out by the poisoning. Such were the level of the severity of the toxicity of carbon monoxide being poured into the whole house, with all family members affected. Carbon monoxide is a gas. It is tasteless, colourless and odourless, and is formed due to incomplete combustion of gas and carbon fossil fuels. The problem is that it's unrecognisable by anyone. As I say, you cannot see it, you cannot taste it, you cannot smell it. And it probably accounts for 50 UK deaths per annum. But the big problem is that there are probably a number of near misses, so it goes unrecognised and undetected, both by the individual and also obviously by the doctors themselves. Often the symptoms are flu-like, and patients complain of sort of non-specific symptoms of dizziness, headaches, sometimes abdominal symptoms. So it's very easy to attribute all of this to sort of winter-type flu. But it obviously, if you can recognise it, can diagnose it, you can obviously avert all these fatalities. Carbon monoxide is heavily taken up by the lung into the red cells, and it competes with oxygen for a place on the red cells and with haemoglobin. The big problem is, of course, is that it prevents oxygen being released to the tissues, the vital tissues, the organs such as the brain and the heart muscle. So effectively the whole of the tissues within the body are starved of oxygen, and predominantly the brain gets affected. And of course, as you can imagine, that as the oxygen is deprived from the brain, then patients effectively become more asphyxiated, complaining of symptoms, drowsiness and eventually coma and death.